kuniacha kamwe, wala kunidharau hata siku moja. Wengine walinihukumu, marafiki walijitenga nami,
na ulinishika mkono hadi mwisho. Kwa magumu na mabaya nani kama wewe. Hi everyone, welcome once again to Saga Prison Stories. Today we are going to have a different topic concerning menstrual health in prisons. But before we go to that, I just want to thank you, our viewers. And I keep asking those who have not subscribed, please don't just watch, subscribe, like, share, comment, and press the notification button so that when we release a new video, you'll be up with us. So without going further, I'll allow my guest to introduce herself, and then we'll go on to the topic of today.
Hi guys, my name is Veronica Gashari Mahulo. It's a pleasure to be here. Thankful to Judith for inviting me to her platform. And as she said, we'll be talking about menstrual health in prisons.
Well, I'm sure a lot of you have wondered, especially those who have listened to my previous stories about the conditions that we lived in those days that we were there. Things were tough. It is, you know, it's miraculous to see that we went through that and we managed, because with God a lot of things are possible. In fact, there's nothing impossible with God. So my guest has a wealth of knowledge concerning endometriosis. Wow, it's a big word. Can you tell us, Veronica, what do you call it?
We just call it endo for those who've been diagnosed for long and don't need to say the whole word endometriosis. So we just call it endo.
Endo. That makes it easier. Endometriosis.
Yes.
A lot of people, especially women, don't know what this is. And before we discuss about menstrual health in prisons, I'll allow Veronica to tell us a little bit about her story and her journey with endometriosis, and then we'll get to the prison factor.
So endometriosis is an inflammatory condition whereby you have painful periods accompanied by other severe symptoms such as vomiting, running stomach. Some people are unable to even function properly because of the pain. So we're raising awareness about the condition because we've realized societal stigma comes into play in this, because when you get to a certain age as a girl, you start menstruating, of course. So all women menstruate, a good percentage of them, except for those who may have other conditions underlying. And you'll find not all have painful cramps, cramps that hinder you from doing your activities on a day-to-day basis. So you'll find those who do have that pain do get sort of ostracized because they're seen as attention seekers, and they're seen as, you know, in our African culture, a woman's strength is determined by how much pain you're able to absorb without breaking down. And unfortunately, through many studies, it's been shown pain can actually change the way your brain works. So years and years of exposure to this pain can now lead to other severe conditions such as depression, whereby people become suicidal, and you just lose hope for life. And it's something you could easily talk about, seek the right medical treatment, and even though the pain won't necessarily go away completely, your quality of life will be improved. So basically, endometriosis is a gynecological condition, mainly inflammatory, and it affects a good percentage of women across the globe.
Thank you, Veronica, for taking us through that. I didn't know that vomiting forms part of of the symptoms of endometriosis.
Yeah.
It sounds more or less like early pregnancy.
Actually, it mimics that. I think there is, I don't know for other women what kind of makes one feel like vomiting, but I'll speak from my experience. Like I said, it comes with running stomach. So because we are afraid to eat during that time, because you don't know how bad the diarrhea can get. Because there was a time I remember I did have a running stomach for 7 hours continuously.
What?
And when I woke up, at that time I was living with my mother, I was at the point of collapsing because I was dehydrated,
Yes.
had not slept, and my body was just giving in. So my mother had to hold me, take me to the bed, and then sort the toilet because I don't have the energy to do that. So I think from that, your stomach is empty, and then you've had that running stomach, and then it's just confusion, I think, in the system.
The system.
And you just feel, okay, now the next stage is vomiting. And then from there, you feel some sort of relief because that mess is over. I don't know what causes the vomiting for other women, but for me, I'd say I used to stay on an empty stomach because I'm afraid to eat, because I don't want to have a running stomach, which I will have because, of course, of the imbalance of hormones. And not eating doesn't help per se, but in your head, you've told you, if I don't eat, I won't have a... But yes, it doesn't help per se. So after all that confusion, now your stomach is like, okay, let's now remove everything, and now you end up vomiting. Yeah.
All right. When did you realize that you had this problem?
Okay, I started my periods when I was 12 years old.
12?
Yes.
12? In primary school?
Yes.
I started when I was in Form 3.
No, I started in class 8.
What?
Just before I joined Form 1.
Whoa, okay.
So
that happens these days, I think, a lot.
Yeah, so before I even got my periods, my stomach was uneasy. And I kept telling my mom, I'm not feeling well, I'm not feeling. So she took me to a doctor. They did a scan and they said, this girl's periods are just about to arrive. So she should be on the lookout.
Okay.
So that was number one. My body was already telling me something is coming. So they finally came. I wasn't in much pain the first years, but I was still not like, because my other colleagues in school, some had started, and you couldn't tell the difference. For me, you would know because I was uncomfortable, I was bloated, and I really didn't know what was going on. Now we go to high school, where the diet is not nutritional per se, and it is assumed that because you receive this education from class 6, 7, 8 as girls, or whereby these companies come to your school and they teach you about pads and whatnot, it is assumed you have the information. So there's that continuance of teaching is not there in high school. It is assumed you know you're a woman now, and you know you'll have cramps, and you forge on. So Form 1, Form 2, I would put on a brave face, and I would go to class. I was in pain. The teacher is talking. I don't know what he's teaching because my head is just focusing on my pain. And then now Form 3 things got bad because I think now the hormones were totally imbalanced, from the diet to the stress. You know, all these things have an impact on your overall body conditions. So Form 3 things got bad. I told my mom, I don't know what is happening, because as my friends are asleep, me, I'm in the toilet, and I'm supposed to wake up at 5, go for morning preps. I'm supposed to perform like them, but the pain has become so bad that, yeah, my life in high school was now, I didn't know I was in depression at the time. I just knew I was not like my other colleagues, because every time, and then because my hormones were imbalanced, I used to get my periods twice a month. After every 2 weeks, I get a bleed. After every, so I was like, So she took me to a GP. The GP prescribed some family planning pills. And then because they were
At what age was this?
I was like 16. So because they were not available at the pharmacy we had visited, and I was on midterm, the mom told me she'll look for them and bring them to school. So when she brought them to school, the matron was given to pass them to me once I came from class. So the matron said, I won't give you these drugs because I don't understand why a 16-year-old is being given family planning pills. Are you sexually active? Do we have a mother in our presence? And I'm looking at her like, I've never even had a boyfriend. So anyway, she said she'll have to wait for my mom during Parents' Day to come and explain why I have these pills for grown-up women.
Yes.
I said, okay. So my mom came, she explained, and I was given. But you see already, the teacher who was passed on by my mother knew I have the pill. She knew. So the story, of course, hakuna siri ya watu wawili.
It went round the school.
Exactly. So I became this person who everyone knows when it's time for her periods. The whole world must know because I ceased to function normally. And then now I finished high school, still hadn't been diagnosed with endometriosis because at the time it was known as dysmenorrhea.
Yeah, I remember something like that. Yes.
At the time they would just tell you it's dysmenorrhea, and of course the narrative out there is painful periods are normal, kunywa painkiller, and forge on. So you do as you're told because, I mean, other women have come before you and they've lived. So clearly you're not unique. But as I said, the pain has a way of changing your brain and how you think and reason and rationalize situations in life. So you finish Form 4, you go to university. University, the same happens, but because again you go to hospital and you're told the same song, you continue with your pain in stride. You finish campus, you get a job, and then now you start missing work. Absenteeism becomes a problem. You start getting warning letters. Not because of your performance, but because of your absenteeism. Doctors write letters saying that sometimes she has painful periods, she cannot come. Sharing with your male boss becomes a nightmare because he asks you, what is the problem? And you're looking at him like, I'm sick. Where are you sick?
Yeah.
You start
It's a difficult topic to discuss.
So finally you go to one doctor who comes up with the magical name endometriosis, and you're like, endo what? And he repeats it and he says, okay, so we'll take you into the theater. We do a laparoscopic surgery, which means it's a minimally invasive. They say it's minimally invasive, but for those who've had it, it's not minimally invasive because much as they don't cut a deep cut where you have to take like 3 weeks to live and be able to stand like a cesarean or something, it's invasive in that you don't really understand what's going on. And they just tell you, we'll take you to the theater to investigate and see where the growths are, and then we'll let you know how bad it is, because endometriosis has stage 1 to stage 4. So there's severe, moderately severe, very severe, and then there's that one where it has covered your whole female reproductive system and can even spread to other organs.
What?
Yes.
What?
You can have endometriosis in your...
Are they like fibroids, or?
No, they're not like fibroids. It's like, I don't know how to put it in a way someone can... It's like you have patches of... Like you have a wound here, or let me say a rash. See the way a rash can spread.
Yes.
So that is how it is. So it starts growing, and then it spreads throughout your organs. Some have it in the intestines, some have it in the lungs. It can go to your brain, your heart.
And that becomes dangerous.
It does, because those who have those lesions on their brain usually get fits, convulsions. those who have in their heart rate is not normal, their heart can get fluid from the inflammation, it swells up. So you end up managing not only your painful periods, but another organ is also struggling to keep up. And then now, because you're in pain, and then of course you're on medication for the organ that is not functioning well, depression sets in. You're not able to perform like your female counterparts at work, relationships. Basically, your life revolves around your periods. You look at your calendar, you know exactly when your period is coming, and when you finish that cycle, you know when the next one is coming, and that is your life.
And it's a lifetime of pain.
Yes, until probably menopause. And unfortunately, even after menopause, some women still have the pain, because if it has already spread to other organs, then you have to deal with that issue until you and your doctor figure out a way. You know, it's basically managing your quality of life, and it's a condition that does not have a cure up to date. So the known way for managing, and the prescribed way for managing it, is the laparoscopic surgery, whereby they go in, it's excised. If it's in a place, it can be excised. If it's in a place where maybe it's attached to a sensitive nerve or an important organ, and it may affect, like it's a 50-50, like if it's on your heart, the doctor goes in and he's like, if I cut here, and so he weighs
the options.
Is it better to remove it or just
let it be,
leave it there? And so it doesn't have a cure. So that is the treatment plan for endometriosis, the laparoscopic surgery. It goes about 300,000 to millions of Kenya shillings. So again, not readily available for every woman. And before you get a diagnosis, you've been to like an average of 6 to 7 gynecologists who've told you the pain is normal. It's all in your head, and you've already started questioning your mental health because you're feeling the pain, but the doctor is telling you there's nothing wrong with you. And so you walk around feeling, I'm not heard, no one is listening to me. And that's how the depression slowly starts creeping in, because you're misunderstood, you're in pain, you want to be like your colleagues, you want to have a fruitful relationships, fall in love. It affects your fertility. Not all, but some. Depending on where it is, if it's on your ovaries, if it has clogged your fallopian tubes, if it's on your uterus, it affects your fertility. So you can imagine you get into a relationship and you tell the gentleman, by the way, I have endometriosis and it's on my ovaries and my fallopian tubes, and there's 70 to 30% chance I may or may not conceive. And so many women end up heartbroken because the gentleman wants to start a family, and once you come right out with that information, it's upon him now to go think, am I willing to be with a woman who may or may not conceive? Of course, there's a societal stigma that you're married, you don't have children. So
I think it's our society, the African society.
Yeah, so you don't have children, and unfortunately they forget that infertility is both ways.
The man can also be infertile.
Yes, the man can also be infertile. So I may have the endometriosis, but like I've said, it is not a guarantee that I will not conceive because of it. So you may end up in that relationship, and because of course you've shared with your husband, and he's probably shared with his family, it is assumed that you are the problem.
And maybe he is the problem.
And maybe he is, you just haven't ascertained. Maybe you haven't gone for the test and all that, but it is assumed because you already disclosed this condition that you are the problem. And then now, of course...
And then stigma again.
stigma in the marriage, there's stigma when you're single, stigma in school, stigma in the marriage. So it's no doubt how depression slowly sets in and you start becoming suicidal and all that. So now you get in the marriage, you're not conceiving. So breakages of homes, domestic violence, because the man is frustrated. You're not giving back. He's getting pressure from his friends, from his family. There's domestic violence in the home. Probably there's infidelity, and he goes and has a family with another woman, or he goes and finds out he is also infertile because he's ventured off to with another woman, but she's still not conceiving. She doesn't have endometriosis. Then he finds out he's also infertile, so he comes back to you. And he may tell you or may not tell you, but his frustrations now start coming out to you in terms of physical violence, verbal abuse, emotional abuse. I mean, the wheel just keeps turning and turning and turning.
Oh dear. Sorry about that, Veronica. It is sad, and it is sad that I think it's the African society, because about children. I'm talking about you must have children.
Yeah.
Because I think in the Western world you can agree with somebody.
Yeah, you can. You can actually have a
and adopt a
conversation.
child. What is important maybe is the love between you. But in our society,
Actually, you've said a very good point, because there are there are some organizations here who because of these conditions, endometriosis, adenomyosis, polycystic ovarian syndrome, which affects your fertility, and maybe you're in a marriage, you've not been able to conceive, or maybe you've conceived and unfortunately it was a stillbirth, or you've miscarried. So there's 2 organizations I know of, Waiting Wombs and Still a Mom. Waiting Wombs mainly encourages women who are TTC, trying to conceive. In that, they try and encourage you that, yes, you are not a mom yet, but you are not just born to be a mom. There is more to you as a woman. Why don't you tap into your talents? Why don't you, you know, make yourself a whole being as you wait on the Lord for conception, or encourage adoption and tell you, okay, you are trying to conceive, fine, but there are other alternatives to having a family. You can adopt. There's surrogacy. I don't know if surrogacy is legal in Kenya or how far it's reached here in the country.
I'm not sure either, but no, I don't know. Let me not talk about that.
Yeah,
I don't know how far it has gone.
But there is adoption, there is surrogacy. I mean, you don't have to conceive the child by yourself for you to love the child. There are so many children in children's homes who need mothers and fathers. And if you're open to that as a couple, it's an avenue you can venture into. And then Still a Mom is an organization which encourages women, because loss of a child is not easy.
Yes.
And you are told, no matter, yes, you've not held your baby in your arms, yes, you've miscarried, but you're still a mom in that your baby is in heaven. And nothing negates that fact. I mean, even me as a person, I can conceive 3 children and miscarry 1. That does not make me a mother of 3. It makes me a mother of 4. Only that 3 are here with me and 1 is in heaven. So they encourage women and they help you go through the grief and loss process in a healthy way through counseling and therapy. And then also having that support group is very, very important. Also for the endometriosis patients, there's an organization called Endometriosis Foundation of Kenya. It's an organization which educates and inspires women to just know about the condition, know your options medically, and be informed in society.
Okay. Wow. You have a wealth of knowledge in this subject. You must have gone through a lot.
Yes,
right from childhood till now.
I volunteered actually at the Endometriosis Foundation of Kenya, and that is why I came to know about all these organizations and formed this passion of awareness, advocacy, because I feel that I suffered for 18 years plus. Another girl should not go through that.
Beautiful. I know. I always say in this channel that there is no testimony without a test, and each person's journey is different.
Yes.
Mine may be different. This is another story. Everyone has something that they can use to encourage others. Everyone has passed through something, one thing or the other. My story doesn't have to be the same as yours, but God uses you, your story, to encourage others. See the beautiful work you're doing.
Thank you.
I have seen the book you wrote, this Blossom,
Yes.
From Girl to Manhood.
To woman.
Oh, sorry. From Girl to Woman. Very beautiful story, and it's quite educative, by Veronica Gasheri Mahulo. You are from all over.
I'm from
Gasheri,
East West.
Mahulo.
I'm from East West and everywhere.
Beautiful.
Yeah.
So if you can get your hands on this book, it's very nice. There's quite some educative stuff on it, on endometriosis. I find it hard to call this thing. Endometriosis.
Yeah.
Okay. Now, Veronica, you are asking me about situations in
Prison.
in the prison. What was your question again?
I saw your story on Tuko.
Yes.
And I also watched a clip of some street girls.
Yes.
And I don't know, it just came to my head like, how do women in prison go through menstrual cycles? Do they know about endometriosis, adenomyosis, polycystic ovarian syndrome? Do they know that this is the reason probably my flow is heavy? This is the reason probably I have blood clots in my periods. This is the reason I'm anemic. Do they have access to sanitary pads?
Let me answer you one by one, just in case I forget. First of all, most women in the prison are not well educated. The majority are not well schooled. So I am sure that others would be going through this and they really don't know what it is. Now I'm going to talk about the times when we were there. Things probably have changed by now because of the reforms. And the reforms even started when I was there. But way before, it was bad. Because, first of all, when a woman has her periods, the first thing they need is enough water.
Yes.
You know, Veronica, what used to happen? Those days, there was this kasuku. You know the kasuku container? I'll show you. The kasuku container was something very valuable to the prisoner. If you had a kasuku, wow, you are rich. Because you would have some, it's 2 kg. Of course, water is not kg, 2 liters or so of water. And that kasuku was meant to help you bathe, brush your teeth, wash your clothes, and magically it used to serve that purpose. Because there was no water. I remember we used to queue with the kasuku. Let me show you the kasuku. This.
So this was enough to bathe.
Can you imagine?
From the same container you brush your teeth?
Yes. A little for brushing your teeth. Just kidogo for your teeth. And then a little for
your clothes.
For your bathing yourself. And you can imagine the cells were so congested. So you can imagine if you wake up in the morning, you're already sweating because of the, a cell that was meant to carry about 40 inmates had 70 to 80.
Double
more than
the
double.
capacity.
So you are sleeping crisscross, Some heads up, some heads down, so that you can fit in. one mattress would hold maybe 3,
Hi.
because 2, 1 up, 1 with the head down, and at the, you know that at the center where 2 mattresses join, another person there. So when you wake up, apart from the normal, you know, maybe you have been working, so you're sweating, that sweat of congestion. But you have to use the 2 kg kasuku to clean yourself.
Did you have soap?
So sometimes I believe that there could have been women with this condition. Probably they didn't even know. Because the only medication that was there was aspirin, Panadol, and Actol.
Okay.
You know Actol, the
Yes.
sweet. So people would just go and pretend, oh, stomach pain, so that you can get something sweet to eat.
Okay.
That was those 3 medications. So if you were extremely sick, then I think it was a clinical nurse, because there was no doctor, would probably prescribe for you to go to Kenyatta National Hospital,
Okay.
or Bangathi, depending on, you know, on what your condition was. And I think for those who used to have, you know, people would come with infectious diseases, like this street, we used to call them Koinange girls. The city council had a way of transporting Koinange girls every evening.
Okay.
They would come in numbers, you know, every single day. And then after a day or 2, because their fines were not much money, they would go, or after a week, those who could not pay the fine would go, but they kept coming in, out, in, out. Probably some, and even others, would have venereal conditions. So there's this hospital that is called Casino.
Okay.
I think it still exists, I don't know. They will probably be referred to that Casino. So you can imagine this one big hall where everybody is sleeping, and then with one toilet at the far end of the corner, one.
For 80 people.
For 80, 90, 70. And this, I think it could be smaller than even 10 by 10. Sometimes you find 10 women, 8 women in this room. Others are trying to brush their teeth. Others are probably cleaning themselves because of those period, the monthly period. Others are already making what, you know, relieving themselves in the same place.
So it was one place for bathing?
Yes.
And for relieving yourself?
Yes.
Okay.
For relieving yourself, for bathing, for whatever. And then you already have described for you the sleeping conditions.
So there's no bathroom, no toilet. It's
No.
bathroom, toilet, and
It's
toilet.
bathroom, toilet. You know those Indian kind of toilets? And then when you bathe, you know, the water goes inside the toilet.
And then...
So if the toilet is blocked, so you can
It
imagine.
rises up.
It rises, so you have to check where you have to check so that you don't step.
And how often would these toilets be clogged out?
If I remember, long time ago, almost every other day. Almost every other day. Before the reforms were brought in, and, you know, donors brought in tanks with, you know, enough supply of water, but it was bad. So if one was sick, back to your question, there are people who would fall very sick, and very sick. I don't think anybody ever understood that, because nobody ever knew of endometriosis.
Yes, it was just
So, you know,
painful
it was
period.
just, I have periods, I have stomachache, it is painful, okay. If it is so bad, go and sleep.
Okay.
With Panadol, or aspirin, or Actol.
Yeah, because for endometriosis, there are scans and the laparoscopic surgery. Is it something the government would put money in for an inmate to be taken to hospital and have the scans done so that they ascertain, yes, this person is endometriosis, MRI, have an MRI done, so that they ascertain that this is endometriosis, that there is inflammation, or is it something that would just be shrugged off?
Just as you've said, you know, you said that in school, there was this, she's pretending, what is she going through? Every other woman goes through this, you know. The same thing would happen.
Okay.
If you find an assistant who is bad, our dress who is, go and sleep. This one is just pretending because she doesn't want to go to work. I had a similar problem. I don't know, they gave me my background. I was a teacher before. I was a lecturer before. So when you go to prison, there are no those. You don't have those jobs.
Yes.
So I was taken to work in the industry. And in the industry, you need sweaters, cardigans for children. I hated that with the whole of my heart. I really hated that thing. And you'd sit in the industry from morning till evening. Morning till evening. So with a bad diet and probably too much sitting, I developed piles. So when I used to explain to this, I think the industry in charge and the wardresses in there, they knew that I hated that job. So when I said I could not sit for long, I could not do this, they said, she's just pretending. She has to work.
Okay.
That stigma is there all everywhere,
So because, like I said, in our African culture,
Yes.
a woman is defined by the pain you can
Endure.
withstand without breaking down. You go, like our mothers, they go to the coffee field carrying sacks of coffee. They farm, you're in pain, you don't have pads, you're using cotton or tissue or blanket, you get rashes, burns, you get yeast infections. Nobody cares because our grandmothers had it even worse. So
Did they even know in the first place?
Exactly.
That reminds me that also those years, the kind of pads that existed, I don't know which factory ever made this. Because you would use them. First of all, I've never even seen them in the market. I don't know whether they were meant specifically for prisons, because I've never seen those kind of pads anywhere. First of all, if you had periods, you had to go to the office, to the officer who was in charge of keeping those pads.
Okay.
Then you go and explain that, Madam, I need pads. Then she'll ask you to prove that you have your periods. So can you imagine how you'd prove that?
Okay.
Can you guess?
I'm trying to figure it out, and the only way is either I take a tissue and swab and show you, or I physically show you.
It was physical. So you had to show physically to prove that you are just not asking for pads. And then you'd not even be given adequate pads. You'd get 2 or 3 pads to last you for the whole day. And they were very bad quality, just as I've said. A lot of ladies ended up with, scratching. I don't know what chemical was used for making those pads, but somehow...
Okay, it is recommended for women to use cotton pads.
I don't even know what kind of pads
it's breathable, because there's a lot of heat. So it's breathable, so the air circulation is moving well. And if you don't use good quality cotton pads,
you get
then yeast infection, the itching.
Yeah, there was a lot of itching, yeast infections and all that. But through God's grace, people survived. And those who had heavy flows, because 3 pads were not enough, would probably end up, cutting the blankets or the torn clothes, or,
And you told me the blankets had
lice.
Imagine.
A lot of lice. So imagine you are cutting a piece of blanket that has lice, and you're trying to protect yourself from the bleeding. So you can imagine the lice, the dirt, the moist.
It's a very demeaning and degrading way.
Yes, it was those days.
Yeah, because you basically don't have access to wash facilities. There is no water.
Yes.
There is no private place for you to bathe.
No.
The place you're supposed to relieve yourself,
everybody else is there.
Exactly. Where is the dignity in that?
I think imprisonment in the olden days was meant to deny you of your dignity. It was made to make you inhuman. You are stripped off of everything that belongs, even your belongings, you enter and everything is taken away from you. And you never see them until the day you are going, even if it's 10 years. So you're stripped of your belongings. You're stripped of your identity. You're stripped of your dignity. Because if you are somebody who had a career, they would say, oh, so you are doing this, why are you here?
Imagine.
You know?
Yet, forgetting we are all humans and we all make mistakes.
Yes. Every human being. I think Jesus asked those who are condemning one, was she a prostitute?
Yes, it said those who have not seen.
If you have, be the first one to take the stone.
And hit her.
And everybody walked away because we have all fallen far short of His glory. And I think no sin is greater than the other.
Exactly.
A sin is a sin. But God forgives. It is we human beings who, you know, we make conclusions and we give people titles and we stigmatize and, you know, God doesn't do all that.
Yeah.
So that is what used to happen. And then you had also mentioned about the diet. The diet, because one with endometriosis, I would imagine is somebody who needs a lot of foods that are rich in iron, potassium,
magnesium,
and you know, all that.
Calcium,
you
all
know?
the important vitamins and minerals.
Yes.
Because if you have a heavy flow, you're prone to anemia. Anemia, of course, you'll be weak.
Yes.
Fainting will be
the order of the day.
Yeah. If you're not eating well, people with endometriosis, because we vomit, and you have that running in your stomach for hours on end, you lose weight tremendously. If you're not eating well, of course you won't be strong enough, and maybe you've been given, I don't know, the tasks. One is there's the industry. There's
the kitchen. Inmates cook for themselves. They are no cooks. So you go there, maybe you've never cooked that big ugali.
And you're anemic.
Yes, and you're anemic, and they put you to go and cook in the kitchen. You can fall inside those pots. They are big.
Because you don't have the strength to turn that thing.
Yeah. So until they discover that you're really unwell and, you know, they are convinced that you're not well, then you can be exempted from those kind of duties. There is the people who go to the garden. There are those people who go for kuni to fetch firewood, just like in the village.
Like there's a place you go.
Yes, there's a place where people from the men's prison, I think, let me talk of Langata. There was Nairobi West, I think Nairobi West or industrial area male prisoners. They would come, and there are these very big chunks of wood. So they are made to slice them into smaller pieces.
Okay.
So now the ladies who are cooking for their other inmates would go. There's a certain point where they would go and tie the wood and carry them on their backs.
Imagine,
you know.
And
they are heavy.
Probably you're on your periods.
And you're of that condition.
You're in pain.
Yes.
And okay, like we say, endometriosis is an invisible disease.
Yes.
It's not like a boil you can see. When I come and tell you I'm in pain, because we've been conditioned to withstand pain. Of course, I won't be wailing and, you know, acting suspiciously.
Yes.
I'll come to you and say I'm not feeling well, and you'll be like, how? You mean you look okay?
You look fine. Yeah, because feeling unwell cannot be determined by probably the way you look. And people who are blessed with the bodies like us, even when you're sick, nobody believes you're unwell because you just look okay.
Yeah.
But it is you who knows how you're feeling. So that is basically what used to happen then. Until the reforms came in, then people were, you know, things changed and they were able to take people to hospitals if you have a bad condition. The x-rays and the scans and what. Kenyatta Hospital is there for that, and I think the government pays for that.
Okay, like I said, before I got my diagnosis, I'd been to like 7 different gynecologists.
Yes.
So before even when this lady gets to Kenyatta and starts explaining, the doctor will tell you, women menstruate, it is normal.
So they suffer in silence.
Mm.
Because you yourself, you don't even know, a lot of people don't even know what that condition is. I think until a few years ago is when we started hearing of it.
Yeah, through Njambi Kwekai, because she's one of the
She's
people,
a
many
great-
people, when you tell them you have endometriosis, they go, like Njambi
Jambi,
Kwekai.
I think I told you that also. I remember seeing her very sick in
Yeah.
India,
Mhm.
in one hospital. I hope she's fine now.
She is doing much better,
Oh, God is good.
fortunately, yes.
Mm.
But that's the thing now. Like you see, many endometriosis patients go for job interviews, and you disclose it, and then they ask you have Njambi Kwekai's condition, so they immediately take you as a liability.
Mamma mia.
They start
Why would
thinking,
they, identify Jambi with that?
They start taking you as a liability in that your medical cover will be expensive, you'll be missing work a lot, etc. And maybe your case is not as severe, because like I said, endometriosis has stages from stage 1 to 4.
Just like cancer?
Just like cancer. And then you'll find even some medics who are not sensitive or empathetic, they'll tell people when they're in the hospital, this condition of yours is just like cancer. You can imagine telling a person who is already in pain that their condition is related to a condition that is known.
That is fatal.
Imagine. They know many people don't survive. So I guess even the medical personnel needs to be educated and made to know that, yeah, this is a debilitating condition, but please don't compare it to any other condition, because it is a condition of its own. Yeah.
Well, thank you, Veronica, for the good discussion we have had. I don't know if there's any other thing you'd like to know about menstrual health in the prisons.
I'd like to know screening, like pap smear. It is advised women above a certain age have an annual pap smear, breast cancer checks. Like, do they have this, we used to call them medical camps?
Okay. The medical camps began after the reforms. But before the reforms, never. The medical camp, they became so many. But the only thing I realized is that, Langat, the prisons in Nairobi, they are very easy to access. And many people don't want to travel far and wide. So the prisons in Nairobi may be well catered for in terms of medical camps, dental health, pap smear, they do. But what about the prisons outside Nairobi?
Country.
Who thinks about them? Those that are far and wide.
And the funny thing you should mention that is endometriosis facilities.
Yes.
They are more available in Nairobi than up country. Because we usually say, yes, we are creating awareness, we are advocating. But what about the girl in the village?
Yes.
She doesn't have pads to begin with. So you go to her and start talking about endometriosis.
She doesn't know what you're talking about.
And she's very confused. Yeah.
I think that just as you have written, I read somewhere, Veronica, that if you want to make the world a better place, take a look at yourself and make a change. So change begins with me and you. If we wait for the government to bring about the changes, what am I? What are you doing to bring about this change? It begins with us.
So that's almost my next question. What do you think how is it now that you're an advocate for life in prison and you're educating us, the public? Have you seen any changes in terms of the facilities, in terms of maybe are they still using a kasuku to
Okay. The famous kasuku. Okay, to answer you, I was in prison just the other day, I think less than a week ago, and I was impressed that now kasukus are normal. I think they're even wiping out the plates that were used. There were some metallic balls, very hot. We used to call them mururu and pengele. I was impressed when I saw plastic balls instead of those ones. The mattresses are no longer the 1 inch, 2 inch. The sleeping conditions are good. Some wards have beds. And most important, there's adequate supply of water. Kudos to those sponsors who are working day and night to ensure that the lives of prisoners are also a little bit comfortable, because as much as one has committed a crime, they should not be condemned
They are
to
human
death.
beings.
They are still human beings. Even your child at home, when they do mistakes, I don't think you can dehumanize your child to the extent that we used to see in the prisons those years. Changes should be made, not only in the prisons in Nairobi, but in prisons all over Kenya. Because when you go to prisons abroad, I keep saying, these people brought in these rules and laws that they brought to us, but they don't use them in their countries. So why should we remain there? Our judiciary should sit down and come up with different things that suit the African society. Let's not copy the Western world. They are not doing what they left for us.
We need to get rid of the colonial...
Have you ever been to a prison?
No, I have not.
I think I'll take you one of these days
Please
when I go
do.
to visit.
Because even as much I've not been in prison, you can see the colonial mentality in offices you visit.
Mm-hmm.
Restaurants, like if you go, you're an African and maybe a white person
comes in.
The waitresses will run to that table. But for you, the African, yeah. So I think we just need to value ourselves as Africans and get rid of the colonial mentality.
We have to wipe that out of our systems, and then we make things or rules and laws that are adequate for the African person. Because we can do it.
So to wrap up, what mainly do you think the government can do?
The government,
to improve life.
The people who are in charge of the justice system, they should visit prisons and correctional facilities all over the world so that they can see, especially the first world, they can see what is happening there. Even if we don't copy everything that they do there, because not everything that is done there, let's take the good ones and practice them. And let's get rid of the repugnant rules, those laws that don't help us, these things that don't help in rehabilitation, like, the caning. There used to be a lot of caning. Maybe some prisons still do it.
I even heard you guys had to squat.
People still squat. You have to squat and you have to address the officer as madam. Like if you are an officer and I come to you, I'll say, madam, ninataka kwenda choo, madam.
So that is the thing about colonial
mentality.
Yes.
Why? They just call, if you're Veronica, it's Veronica. Veronica. And I'm Grace or Saga or whoever you want to call me. You call me by my name.
But you would see that even in high school, because there was a time prefects, you are served by a student, yet you're paying the same school fees.
Yes.
And then the student has to take your plate and go and wash it. I mean, basically they were living a princess sort of life.
Yeah. Those kind of things should be abolished.
Yeah, colonial mentality
should be abolished.
Yeah.
Anyway, thank you so much. I have learnt a lot from you.
Thank you.
I will call you again so that we discuss something else.
Yes.
And my viewers also can tell us what they would like us to talk about. If there's anything we didn't cover on this topic, just go down to the comments. Let us know what you'd like Veronica to tell us about or what you'd like us to cover. Thank you so much for being with us. I can never stop thanking you, those who support us. I have friends from all over the world who support our channel in one way or the other. They have contributed, they have given us advice, they have prayed for us. They ask us when we are going to prisons, what can we do? Thank you so much, and may God really bless you. If you've not subscribed, please do. Once again, thank you, Vero.
Thank you for having me. Yes.
Bye-bye.